where we take you beyond chemotherapy and scans into the heart, what really supports healing during cancer, your mind and your meals. And yes, I am your host Sherin, and today we are diving into something many people overlook but patients feel every day. How emotional support and the right nutrition can dramatically transform the cancer care journey. We often say cancer care is a team effort, and today two of the most compassionate players on the team are joining us. Hafsa, our brilliant onco-dietitian, Jaitri, our insightful psycho-oncologist. Get ready for stories, science and tips that are practical, powerful and maybe even life-changing. So let's begin. Cancer isn't just a physical illness. It deeply affects our emotion. Fear, stress, loneliness, they all show up, especially during treatment. And mental health is often sidelined. So can you walk us through how your counseling helps patients feel emotionally stronger?
Absolutely, Sherin, as you said, during the cancer treatment, anxiety, distress, depression, isolation, feeling guilty, all these emotions are very common and these are valid as well. So here during the psycho-oncological counseling session, we teach them multiple coping strategies, for example, stress management techniques, so that their defense mechanisms can be very strong, which will help them to fight against cancer. So here let me give you an example for all. Cognitive behavioral therapy or CBT. Here we try to reframe the negative thoughts into the positive ones. For example, if the patient is thinking, I will not be able to tolerate the side effects of chemotherapy, we like to change the statement as, let me try, this is always one step at a time. So here we need to understand, in psycho-oncological counseling session, we not only teach them to be psychologically healthy during the cancer treatment, also we try to train them how to be physically resilient as well. As a result, what will happen? Their cortisol, which is a stress hormone, that will come down and patients' overall well-being can also enhance. There is no physical health without mental health during the cancer treatment.
Thank you, Jaitri. That was powerful. So now let's talk about food, because nutrition isn't just about calories. It's connected to our mood, energy, even our thoughts. Hafsa, how can the right food improve emotional well-being during treatment?
Yes, Sherin, there's a very strong connection between your gut and your brain. There are certain nutrients in food that will help improve your mood and support your brain health during the cancer treatment. Nutrients like omega-3 fats like EPA and DHA, they are especially very helpful. EPA, in short, eicosapentaenoic acid, that can cross into your brain and reduce the inflammation, which may help lower the stress and depression. DHA, on the other hand, known as docosahexaenoic acid, that helps brain sense message faster, which keeps your mind sharp, and you can get EPA and DHA from foods like salmon and sardines. Another important nutrient is tryptophan. This will help make your body make serotonin. Serotonin is a chemical that lifts your mood, right? So tryptophan is found in foods like curd, pumpkin seeds, oats and tofu. Eating walnuts and berries are also very helpful. They take care of your mental well-being by helping your brain feel more relaxed and happy.
So there is so much talk about food as medicine these days. But for cancer patients, this isn't a trend. It's a necessity. What does your nutritional care fit into the big picture of healing?
Exactly, Sherin. Nutrition is not just a side dish, it is a main course of care. A healthy diet supports not just physical healing but also the mental healing by reducing stress and anxiety. Anti-inflammatory foods like leafy greens and turmeric, it can help reduce treatment-related inflammation and discomfort. So eating a balanced diet is very important for cancer patients. It helps the body stay strong during treatment like chemotherapy or radiation. So a healthy diet gives the energy needed to fight the tiredness and supports the immune system that protects the body from infections. It also helps manage the side effects like nausea, constipation, and also supports the healing after the surgery. So eating the right mix of fruits, vegetables, whole grains, proteins and healthy fats can help maintain a healthy weight and improve your mood. So overall, good nutrition helps cancer patients feel better, recover faster and respond well to the treatment.
Thank you, Hafsa. Now let's talk about emotional well-being. When we talk about holistic care, it's all about integrating mind, body, and nutrition. How does your psychological counseling complement other parts of the care plan?
Beautifully said, Sherin. Healing does not happen in isolation. When cancer patients feel mentally empowered, they are more motivated to follow a good diet plan, healthy lifestyle pattern, adhere to their oncologist visit, stick to a routine, and trust their bodies. So here, let me give you an example. How we can help the patient as a psycho-oncologist. I remember one patient, let's call her Asha, who hadn't left her home in the last 6 months, also stopped visiting her oncologist and also the chemotherapy cycles because of the fear of getting the side effects. Her anxiety was so severe that even the thought of going to her front gate made her feel faint. We started small. First, stepping into the balcony, then walking to the mailbox. Slowly but surely, she built the courage to visit her oncologist and again restart the chemotherapy cycles. So here, I would like to add that psychological counseling helps build that inner motivation, turning fear into focus and stress into strength.
It was very heart-touching, Jaitri. So speaking of stress, it's one of the biggest enemies in cancer care, right? How do you help patients manage stress and reduce its impact on the body?
See, Sherin, stress is something every cancer patient talks about. And here we need to understand that this stress is not only about physical, it can be psychological, social, behavioral, and even spiritual. And now science tells us that stress can increase inflammation in the body. This makes it even more important to manage stress during the cancer treatment. Here we need to understand that chronic stress leads to inflammation during cancer treatment. So here as a psycho-oncologist, we teach the cancer patients mindfulness meditation. And here the mindfulness reduces stress, activating body's parasympathetic nervous system, which manages inflammation. For example, teaching mindfulness meditation can lower the stress level, reducing inflammation. It can be as simple as that, taking a few deep breaths and focusing on the present moment. By learning to manage stress, the cancer patients are not only benefiting their mind but also reducing the inflammation in the body, leading to an overall improvement in how they are feeling.
Thank you, Jaitri. So now let's talk about diet, which plays a role here too. We know that food can be anti-inflammatory. Can you share some easy tips for patients looking to reduce inflammation through what they eat?
Sure, Sherin. During cancer treatment, eating the right food can really help reduce inflammation and manage the stress. We usually suggest simple changes like adding nuts and seeds which have healthy fats that fight inflammation, and citrus fruits like oranges that help the body handle stress. Including curd in your meal gives good bacteria for your healthy gut, and a fiber-rich sabzi supports smooth digestion. So a healthy gut not only improves immunity but also helps with mood and overall well-being. In fact, nowadays, few well-known gastroenterologists often talk about the importance of gut health and how it plays a very big role in managing inflammation and supporting recovery. So small daily choices like a bowl of curd, fresh fruit, or a handful of nuts can make a big difference in how you feel during the treatment.
So now let's get practical. Eating during treatment can be tough. Nausea, fatigue, lack of appetite, it's real. How do you help patients improve their food intake during tough times?
See, providing nutrient-rich options to support cancer patients during the treatment is very essential. Soups with vegetables and lean proteins offer vital nutrients, especially for those with reduced appetite due to emotional distress. Additionally, including whole grains and healthy fats ensures sustained energy levels in the body. Snacks like curd with fruits or nuts provide convenient calorie-dense choices to meet the nutritional needs throughout the day. So by emphasizing a balanced diet, we aim to optimize patients' nutritional status and overall well-being during their cancer journey.
That was very informative, Hafsa. So, when patients feel low, food often loses its appeal. Can counseling really help with that?
Absolutely, Sherin. Low mood, anxiety, or irritability often impact appetite and food habits negatively in cancer patients. For instance, a patient struggling with low mood might skip meals, but with psychological counseling and support, they learn coping mechanisms to maintain regular eating habits. Mindfulness practices can reduce stress and improve the eating experience. Techniques like mindful portioning, serving modest portions and engaging the senses. For example, focusing on the colors, smells, textures, and flavors of food can enhance the eating experience and can increase appetite among the cancer patients.
So, Jaitri, sleep is another silent struggle. Poor rest can slow healing, drag down energy. How does psychological support help with sleep?
See, Sherin, psychological techniques can improve sleep for cancer patients. So now let me discuss a few strategies to improve the sleep-wake cycle. Number 1, sleep hygiene practices like maintaining a consistent sleep schedule and creating a relaxing bedtime routine. Number 2 can be practicing relaxation techniques such as deep breathing or believing in here and now or progressive muscle relaxation technique before bedtime. Number 3 can be practicing certain cognitive behavioral therapy for insomnia patients especially, which can address the thoughts and behaviors that interfere with their sleep. Number 4, but the most important technique can be practicing mindfulness meditation to calm the mind and promote better sleep quality during the cancer treatment.
So that's very relatable issue. So Hafsa, we also get the questions like what should I eat for better sleep? Some food and meal timings may help calm the body and support rest. Can you guide us on how diet support better sleep in cancer care?
This case actually shows how small but targeted dietary changes can really help manage the side effects like poor sleep. It also highlights how follow-up sessions are important. They give us a chance to check what's working with the patient and make changes if needed and keep the patient motivated along the journey. So sleep plays a very key role in healing, and the right diet can be gentle and a natural way to support that.
Yes, Hafsa, you are absolutely right as you spoke about the importance of follow-up counseling sessions. Let me tell you here that a few days back, I met with one patient and she came with the complaint of completely low mood, feeling of being dependent upon spouse and other family members. Also, the husband reported that nowadays also she is not stepping out from her house. So what we understood that body image was the main factor here, the alopecia, skin discoloration, blackish and brownish nails and all that. So what we did here, let me tell you that not only the first session, we conducted multiple follow-up sessions and we helped the patient to come out from this trauma. We informed that no, everything is so much temporary, all these side effects, and she is going to regain everything, including the confidence and hair and every other aspects in her life. So the final result was really amazing. She not only started stepping out from the house and also attending all the chemotherapy sessions, but also now she is in her remission. So here we need to understand that addressing both mental and physical health is essential for a comprehensive cancer care.
Wow, that's a very inspirational comeback of that patient. Now that I realize that together diet and psychological well-being enhances the quality of cancer patients. What do you have to say about this, Sherin?
Yes, Hafsa. From this whole podcast episode, I understood that diet and psychological counseling are not ancillary services, but integral part of our effective cancer treatment. So I would like to ask the audience about their experience in such situations, where they felt emotionally distressed or any side effects or sleep problems, and how they overcome these challenges. And yes, I'm happy to share a little about OncoBuddy, a platform that's truly changing how cancer patient gets support during the treatment. And this journey is the one of the most helpful features we have seen is how patient can easily send in their queries. Whether it's about diet, medication, test reports, or even emotional well-being, directly through the OncoBuddy app. For example, we had a patient who was feeling anxious about a sudden change in appetite and trouble sleeping. She typed her concern into OncoBuddy, and within a short time, her questions was answered by a certified dietitian and supported by a psychologist as well. She received personalized suggestions, including meal ideas and stress-reducing techniques. She felt heard, guided, and reassured with her comfort zone. She felt heard, guided, reassured, all from the comfort of her home. What's special about OncoBuddy is that every query is handled by qualified medical professionals, from doctors to genetic counselors and onco-dietitians and psychologists. So, patients get the right information at the right time, and during follow-up, they can update their progress, ask more questions, and continue to get support throughout the treatment. It's more than just a Q&A. It's a companion in your cancer journey. Making sure you're never alone and always cared for by the right expert. And yes, to all our listeners, don't hesitate to reach out to your care team. You're not alone in this. We hope today's discussion helped you understand how small steps in mindset and meals can make a big difference. So stay strong, stay supported, and we will see you in the next episode. Together we beat cancer.